Various factors contribute to eye attractiveness, including specific ratios and measurements that are commonly present in attractive men. For instance, analyzing the eyes of such individuals reveals similarities, like positive canthal tilt, ideal positioning, and ratios. Conversely, unattractive men tend to lack these ideal measurements. Merely by examining images of the eye region, one can determine the subject's attractiveness with a fair degree of accuracy, underscoring the significance of this particular facial feature. Fortunately, in 2023, various techniques are accessible to rectify suboptimal measurements or approximate the desired outcome. In this video, we'll be discussing various approaches to improve undesirable eye features. However, it's important to note that not all characteristics are amendable, and therefore, we'll focus only on the ones that can be addressed. Additionally, we'll touch upon what constitutes an appealing eye area in the future. Deep-set eyes are defined as eyes that are positioned further back within the eye sockets, creating the impression of a more prominent brow bone. This unique placement can create the illusion of sunken or more prominent eyes, depending on other facial features. The brow bone projecting forward casts a subtle shadow over the eyes, giving them a mysterious and alluring look. Additionally, due to the brow bone's projection, the upper eyelid may appear less visible when the eyes are open. It's essential to note that having upper eyelid exposure does not necessarily imply that one does not have deep-set eyes. For instance, Irish actor Cillian Murphy exhibits upper eyelid exposure despite having deep-set eyes. This explains why his eyes appear aesthetically pleasing even with a high upper eyelid exposure. In addition to this, the horizontally wide and vertically compact orbitals and eyebrow positioning serve to enhance the overall appearance. Conversely, limited or absent upper eyelid exposure may indicate protruded eyes, which is likely due to weak orbital bones. Bulging or protruding eyes are often deemed unappealing, bearing semblance to a bug-like appearance. The eyes bulge out of their sockets, creating a vulnerable and unhealthy look. Additionally, the orbital vector, which refers to the relationship between the corneal apex and the malar eminence in the sagittal plane, can determine the presence of this condition. The vector of the orbit is crucial in treating eyelid malpositions, particularly with canthal ligament tightening procedures. The vector of the orbit is determined by both ocular and midface factors. On sagittal view, a line or a vector is placed between the most anterior projection of the globe and the malar eminence and lid margin. A positive vector relationship exists when the most anterior projection of the globe is posterior to the lid margin and the malar eminence. A negative vector relationship exists when the most anterior projection of the globe lies anterior to the lower lid and the malar eminence. The upper mid-face skeleton plays a crucial role in shaping the face, particularly the eyes. The relationship between the eyeball and the orbital rims is instrumental in determining whether the eyes appear prominent or deep-set. Given that the infraorbital rim and upper mid-face skeleton support the lower eyelids and cheek soft tissues, their projection has a significant impact on lid and cheek positioning. Individuals with poorly projecting mid-face skeletons are predisposed to premature lower lid and cheek descent with aging. This lack of skeletal support may also lead to lower lid malposition after blepharoplasty, and limits the efficacy and longevity of mid-face lifting. Augmenting the infraorbital rim alone, or in conjunction with other soft tissue manipulations, can have a profound effect on the periorbital appearance. It is possible for individuals to have protruded eyes and a negative orbital vector without being aware of it. The presence of a negative orbital vector may be the cause of tired and enlarged eyes. In 2023, there are currently two options available to rectify a negative orbital vector. The first option is orbital decompression, which involves a meticulous removal or thinning of the orbital walls and orbital fat. This procedure aims to expand the space within the orbit, allowing for the accommodation of abnormally enlarged muscles and tissue that surpass the natural volume of the orbit. The extent of decompression can be tailored based on the severity of proptosis, taking into account functional and cosmetic considerations. In certain cases, the increased volume of orbital contents exerts pressure on the optic nerve and surrounding blood vessels, resulting in exposure keratopathy, optic neuropathy, and other visual disturbances. Some results of orbital decompression demonstrate the impact of surgery on the eye width to height ratio, and the relocation of the eyes within the socket, resulting in a more confident appearance. The complication rate of orbital decompression is relatively low, with topdoctors.co.uk indicating a risk of approximately 1 per 1,000 individuals. However, a 2016 study suggests that the complication rate is approximately 9.3%. The utilization of custom orbital implants is a viable alternative. These implants serve to enhance the projection of the orbital rims, particularly the supra- and infra-orbitals, resulting in a reduction of eye protrusion and a more pronounced deep-set appearance. To achieve the most favorable outcome, I recommend a comprehensive approach that combines orbital decompression with the implementation of orbital implants. This is particularly crucial in cases where a high negative orbital vector is present, as relying solely on implants may yield unnatural outcomes. For optimal long-term outcomes, I suggest utilizing polyether as the preferred implant material over silicone due to its higher biocompatibility and lower risk of infection, inflammation, and rejection. Although silicone implants are less expensive, they are more susceptible to complications such as migration and infection, and may require replacement over time. While there are other biocompatible materials available, such as polyethylene, I would recommend PEEK for custom facial implants. It is important to note that the side effects and complication rate of orbital implants are minimal. There's one other surgery that can completely fix protruded eyes and can provide better results, but the problem is it's difficult to find a surgeon who will perform this surgery. The name of the surgery is Monobloc. To fix protruded eyes, you either have to push your eyes back into the sockets like in orbital decompression, or make your orbitals push forward to create the same results as in orbital implants. And Monobloc does the same. Monobloc frontofacial advancement surgery moves the bones of the forehead and the middle of the face forward. Currently, this is only performed in children with deformities, mainly Cruzen syndrome. Complications rate of this surgery is around 25 to 30% or more according to some studies, which should be because this surgery looks brutal. This can also be performed in adults with fairly same complication rate. Another option is Le Fort 3, which is shown to be less risky and may help in that regard. If you are looking for facial analysis and glow-up advice, our custom report, available through the provided link in the description, offers comprehensive facial analysis and expert advice on enhancing your looks.